we wanted to bring on a hopefully a new friend of ours, British-Palestinian surgeon Dr. Khaled Dawas. Dr. Khaled traveled to Gaza with medical aid for Palestinians to provide essential medical care at al-Aqsa Hospital in Gaza. His first visit in January was followed by a second trip just a few months later. He just came back a few weeks ago. Dr. Khaled, thank you so much for joining us today.
Hi, Nora. Hi, Ali.
Hi, Dr. Khaled.
Hi. It's good to have you. First off, your reaction to just in the last few days, the kind of escalation, if you can even call it that, of Israeli bombings, especially in northern and central Gaza, where you were working. What have you been watching closely?
It's interesting. Today, I was talking to a colleague of mine who's just come back more recently than I did from Gaza. He came back a week ago, and we were comparing notes. We was talking about how we react to noises and images that we see. And walking to work today, I heard a noise in the background. It was a sort of a loud banging noise. I didn't flinch, but in my mind, my response was, "Who's been hit?" And he said exactly the same thing. We get conditioned to these things. So looking at the pictures and the news that we watch nowadays, I think it was expected. We knew, if you'd asked me 2 months ago, 3 months ago, when all the talk about not going into Rafah because the American administration was pushing the Israelis not to do so, I think we knew, I think that was ultimately going to happen, because that was the stated aim from the beginning, and it would be politically suicidal for the Israeli government not to do so. Nevertheless, though we expected it, we all feel the pain of people living there. I have the added guilt of knowing that colleagues of mine are still there, and I could leave. I was in touch with one of the doctors at the Kuwaiti hospital soon after the more concerted effort on attack on Rafah happened, because we know that Rafah has been hit every day since the beginning. And he's a particularly resilient man who, back in October, sent me the voice message which told me that he'd received the first threat by the Israeli forces to get out of the hospital and to clear the hospital. This was back in October, and I remember the panicked message that I got from him, and I also was very panicked, and we tried to get people together to try and, in the hope that some pressure would work. Now, whether that pressure did eventually come up with a result or not, ultimately at that time there was no attack on that particular hospital, but we know that since then the Yusuf al-Najjar hospital in Rafah and the Kuwaiti hospital, I want to just qualify the Kuwaiti hospital, what the Kuwaiti hospital is, because I went to see the Kuwaiti hospital in January. The Kuwaiti hospital is a 15 bedded unit, which has 2 operating theaters, no intensive care, no CT scanners, and had the sign that I famously, for myself, display when I sometimes talk, which says "La hafadat, la fuwat," and which means no pampers and no, they call it bambers, in fact, not hafadat, and no female hygiene products. That was where I took that photograph from back in January. So it's inevitable, but nevertheless, you feel that anger and sadness that we all feel. I do feel very strong that we have to still maintain the sense of resilience, because we carry that sense of resilience from us in Gaza. When I went in Gaza, that was a message: don't forget us, and don't let the overwhelming sadness and grief become the dominant theme that we have in our response.
Dr. Khaled, you were in Gaza in January, and you went back again a few months later, and you just came back in mid-April. So you've been to Gaza twice in the space of a few months during this genocide. I want to ask you to talk about where you were in Gaza in terms of the different hospitals and the differences you saw in terms of the different locations, and in terms of between January and April. How had things changed?
If I take you, Ali, on a trip from Rafah to where we were, Deir al-Balah, which is in the middle of Gaza. So the trip we took back in January started off going from the crossing, which is now closed and partially destroyed at least, to Rafah, which was very busy back in January. So this is December now. We actually got into Gaza on December the 26th after a day's delay in Egypt, and we drove from the crossing to Rafah city center on our way to what was at the time our house in Khan Yunis, and it was very crowded. We had to divert the route that we were taking because of the crowds in the roads. And then this was my first exposure to Gaza in that instance. And I remember very clearly being astonished by the number of people on the streets, people on donkey carts. There were some cars driving around and people carrying the raw materials for their tents. They were carrying the pieces of wood, they were carrying the plastic, and then you could see people setting them up. I saw a barber who would set up shop in one of the corners just outside a wall. And that took us a good part of an hour to get out of Rafah and then get to Khan Yunis. That road beyond Rafah to Khan Yunis was fairly rural. I mean, I would describe it accurately as a rural road at that time. And we stayed in a house in an area called al-Mawasi, which is to the west of Khan Yunis, which is the so-called designated safe area. And then that house subsequently, by the way, got hit by the Israeli Air Force a week after we left it. And there was a second team in there when they got hit. And we received via the two charities I went with, MAP and the IRC, 6 different explanations as to why that house was hit. Then the route from Khan Yunis and Mawasi to the hospital, again, was fairly rural until you hit the al-Balah camp. The al-Balah camp is on the coast. That sort of segment of about 1 kilometer was extremely crowded. It would take us another 20 minutes just to get to 1 kilometer, and then we would turn right heading east towards the hospital. Just beyond the al-Balah camp. And that route was very busy. Outside the hospital was extremely crowded. The road, the last 200 meters were probably the most crowded bit. People walking around. There were some stalls on the side, people sort of selling whatever there was to sell at the time. And then the grounds of the hospital were packed with tents from the outside. And the hospital itself was full to the rim with people lying on the floor. And I remember very clearly the people lying on the beds, in between the beds, on the floor, and the carers were the families mainly, because there weren't enough staff. Now the difference back in April was that when we drove, we stayed in Rafah for the first night in April, and we decided that the journey from the house to the hospital was the most risky part of the journey, if not just for us, but also for our colleagues who were providing the logistics, our transport to the hospital. So we decided to stay in the hospital. This time around, the road from Rafah to the al-Balah was absolutely full to the rim with tents and people, and you couldn't see the sea. The sea from the road is probably about 100, 200 meters at most. We could not see the sea because of the tents. So that was a very dramatic difference. The al-Balah was a little bit quieter because people had moved south at that point. We left the al-Balah in January after the hospital was hit with a missile that went through the wall. So that was the beginning of people moving further south. And we know after we left in January, there were more hits on the area around the al-Balah, including Nusayrat and Maghazi and Zawaida and the rest of them.
Dr. Khaled, can you talk a little bit about your specialty and what kind of daily life was like as a surgeon working in these conditions, and maybe talk about some of the patients, some of the families that you met and treated.
Yeah, I often remember them now, and I get a bit emotional talking about some of these sometimes. I have to sort of gather myself. In January, my field is gastrointestinal surgery. My regular work in the UK, I deal with abdomen and thoracic surgery, chest surgery, because of my subspecialty, which is dealing with esophagus surgery and stomach. So I have the skills and the confidence to deal with surgery within the chest and the abdomen, and that's what I did on both occasions. And I'd say the vast majority of my work was dealing with abdominal injuries, but also quite a lot of work in the chest. And the vast majority were due to shrapnel injuries, but then we had days where you had clusters of bullet injuries. And why that would happen was, my interpretation was that you would have things like quadcopters hovering in a particular area, and they would be firing bullets. And what appeared to be fairly random, because people who were coming in were all ages, women and men, and there was no particular clustering of a particular type of human target, to put it bluntly. So the kind of memorable things I have, the memorable stories I have from January, which were mirrored and amplified in April, were particularly some of the injuries which were new to me. I mean, they were new to me in December, January, because I hadn't dealt with what shrapnel does to you. Shrapnel, shrapnel defined as anything that flies as a result of an explosion, which causes debris of any sort to fly in a very fast direction, and very, very fast, very quickly, but also very hot items, piercing people's bodies and causing indiscriminate and unpredictable injuries. And as soon as it hits someone's body and pierces the muscle and the skin, it goes in a direction which is unpredictable. So you end up with the insides of somebody being torn to shreds because you can't tell that from the outside. We didn't have scanners in Deir al-Balah, in al-Aqsa hospital in January. We had a head scan only that worked, and for body scanning we didn't have. So you had to make your decision based on your clinical judgment and what you think was the mechanism of injury and where they were and what perhaps their relatives and their friends told us had happened at the spot. So we're dealing with a lot of fairly blind approach to surgery to try and salvage, save, and help as many people as we could. And I remember particularly one very bad morning. It was just after New Year's Day, and we went down to the emergency department and saw three. We saw one particular. There was one boy who had his head wrapped in some dressing with a ventilator, and he was probably about, I'd say, 12, 13 years old. But we discovered then that he was dying because he had a severe head injury, and there was nothing we could do about it. There was no service to save his life. But at the same time, we found the boy sitting outside, lying unconscious, but breathing in the reception area. And we discovered that he had a pretty big injury in his lungs. We could see his lungs through his skin. And we moved him quickly, the team I was with and we moved him to the resuscitation area. But to move him there were no beds. We had to move that boy who was dying on the ventilator off the bed onto the floor and put him on the bed. And we had to deal with his chest injuries, but also at the same time, his sister, who was 7 years old and a bit older than him, happened to be on the floor in agony, screaming in agony because her leg was broken. And we had to later on straighten that leg without any anesthesia. So I remember looking up from that scene and just taking a picture in my own mind for a picture of what I was seeing and the implications of what I was seeing for these people. And this was a recurring theme. I was seeing this one day. The people working there and the people living there were seeing this constantly. Moving to April, I went back and I had regretted after January that I did not record people's names and stories in a moment, because I felt I was obliged, when I thought about it, when I came back, to amplify their stories. They have no voice, these people in Gaza. And it was one of my missions, not just to go as a clinician, but also to go and amplify their voice and for people to hear what their stories are. And I only took first names for obvious reasons, but I have so many stories. I mean, when I went to Gaza in April, I took a book with me called I Am Pilgrim, which you might be familiar with, a very big, chunky fiction book. I could write 2 books like that on the experiences I've had in Gaza. And I'll just give you a couple of examples of stories, perhaps in April. Of course, we focus on children a lot. We all, people do, because it's the most obvious story that pulls at people's heartstrings, and I'm all for that. But we can't also forget their parents, their sisters and their brothers who are older than them, and their grandparents who are also dying and being injured and mutilated in large numbers. And I remember on the 7th of April, I was asked to see a 17-year-old girl called Lemma. Lemma was there with her father, and it turns out later on that she was the only child for her parents. And she'd had a shrapnel injury, she'd had abdominal surgery, but she had to go back to theater because, as happens with shrapnel, you don't find everything on the spot. You often find you operate on them. 2 days later, something else happens. Something else declares itself, which you hadn't picked up because you just couldn't see it. So she needed to go back to see a surgery, and I took her back to surgery myself and operated on her, and she had an operation which involved removing some more bowel and also bringing out what's called a colostomy, where you empty your bowels in a bag. And this is a 17-year-old girl. And we operated on her, and her father, I remember, extremely caring, very intense man who we had to ask to calm down at times because he was very intense and understandably so. Now, I kept seeing her pretty much nearly every day until I left on the 15th of, I left Gaza on the 15th of April. And I asked my colleague who's going in there to keep an eye on her, and we took some instruments, some equipment to help with her care afterwards. And then as they were leaving in early May, I got a text from her aunt, who I kept in touch with, and said to me, Lemma just passed away this morning. Very upsetting. And it took me a while. I remember where I was when I got that message. And it gives you a sense of hopelessness, because you do these things, and despite all the work that one can do medically, and not just me individually, this is not about me, but it's the hopelessness of people who go through these injuries and yet come out of it with some hope. But that hope is dashed away, not just because they live where they are, but because actually the injuries that they get are so serious, and it's the only fault they have is either because their age. I mean, young men are being targeted in a horrendous way. The number of men I saw, young men, who is just unbearable to see, because and their only fault is they happen to be men between the ages of 16, 17, and 25, who happen to be with their families, and they are targeted because they are young men. So these are stories which I will, they will live with me forever, and I owe it to them to kind of keep these stories alive.
Yeah, it must just be impossible, doing your best with the resources that you have, as surgeons, as medics, as nurses, as physicians, emergency room doctors, and they just keep coming, and it won't stop, and the world won't stop it. Can you talk about how your colleagues are doing right now? The ones that you work very closely with, who are in, these hospitals that are receiving evacuation orders, that at the same time that they're receiving dozens of injuries, from, children to elders. What are you hearing from your colleagues?
So I hear the stories from Deir al-Balah, from the Aqsa hospital, and I also hear the stories from Rafah, from particularly the Kuwaiti hospital, and I've got some colleagues who are working in the European hospital. Those are probably the three main hospitals left. And I just reiterate the fact that the Kuwaiti hospital is not a proper trauma hospital. This is a glorified surgical practice. And the doctors in Deir al-Balah particularly I got to know them very well. I spent days working with them, weeks working with them, but also I spent a lot of time talking to them when we weren't operating. A very resilient bunch of people. Of course, they're humans. They lose it. They're less patient than they were in January. They are more on edge than they were in January, but some of them have had to move homes multiple times. So they've got to think about their families. And one particular doctor who I'm very fond of, he acts as the head of the surgical department at al-Aqsa hospital, a very patient man who I used to walk around with. And despite him doing this now pretty much day in, day out for, at the time, 7 months, when people grab him, as they do, as you walk into the hospital, people grab you because they want your attention. They want you to answer their questions. They want you to ask you about their relative or themselves. And it's very intense. Meters without someone grabbing you because they want to ask you something. And he would always have the time to listen and reply and smile, and then he would walk away. We'd walk away, he'd smile at me, and we'd smile at each other because we acknowledge the need, the desperation of people there. He told me one day as we were, in fact, he told me several times the same story. He said talking about his son, who is a 17-year-old boy who was just about to finish high school this year and go to university. And his son is extremely depressed that now he feels his future is lost. Of course, we hope it's not lost, and we don't. And I really pray it's not lost. And if when this is over, there'll be lots of people who want to make sure that this is the case. But he was depressed, and he was having a tough time with his dad because he feels that his dad should have looked after them better. Of course, we all know that that is not possible. It's beyond his control. But his father, my colleague, felt extremely guilty about this, and was asking me rhetorically, "What do I do with my children? The eldest I have is 17. The other ones are all in school. We have no schools left. What's going to happen to them?" So these doctors have to live with this in the background, the worry that when they leave home and go to hospital, they may not go and find their homes when they go back home. This was communicated to me several times by my other colleagues. So they carry on, and a part of them carrying on is also them not wanting to take a break and sit at home and worry about what could happen to them when they're at home. So I tried to convince him that one of the reasons we were there in Gaza was to give them relief. And that was genuinely my belief, that we were there so that they could go home and have a break. But they don't want to have a break, because having a break, well, there's no such thing as a break. They're sitting there with bombardments and stories of misery and destruction and death all around them. They'd rather be busy, feeling that they can do something productive. And there are doctors who feel, particularly the younger ones, who have aspirations, have futures that they worry about, their careers, their progression, their education, their training. Many of them, and I'm still in touch with them, who ask me, can I come and finish my training in the UK? Or are there any options for me to go outside, and can you help with that? And many of them want to go back to Gaza, and I believe they do. But they know that there is going to be a big problem for the next few years as to how they finish their training, their careers, and how they progress and become the people that they want to be. They have aspirations. These are very ambitious people. I chair a charity called 𝐓𝐡𝐞 𝐄𝐥𝐿, which deals with medical schools in Palestine. I know what they're like. I've interviewed many of these students, spoken to them. I've gone to visit them during exams, and I know what they're like. So their aspirations and their wishes and their ambitions to improve themselves and come back are genuine. But what's going to happen for the next few years, when I hope most of them will survive, because some of them, we have lost some of them were also included in the group of people who were imprisoned. They were taken by the Israeli forces out of al-Shifa and Nasser complex and put in prisons, and I met some of them, I've seen some of them. They have a very difficult time coming psychologically to terms with what's going on.
Go ahead.
Dr. Khaled, listening to you is unbearable, and going through what you've been through and bearing witness to what people in Gaza are going through must be infinitely more so. So I'm not sure what I have to add except to say thank you for going and for bearing witness and for telling the story of Lama, of her family. And I think about your colleague, I don't know if you know him personally, Dr. Hassan Abu Sittah, who was in Gaza for 43 days and came out and has been doing exactly what you're doing now, which is telling the stories, bearing witness to what he saw, which is, I think, as important as the healing work you do. And I don't want to underestimate that. I think educating the world is as important. And as you will know, he was slapped with a ban by Germany, which effectively banned him from entering most of the EU. And that was just overturned yesterday in a court. I mean, I just want to ask you to reflect on the perversity of silencing doctors who are witnesses to genocide in a continent which proclaims itself to be founded on the ashes of the Holocaust and on learning the lessons of never again. And I want to ask you what reactions you've been having since you came back and have been talking about what you witnessed in Gaza and the people that you worked with, the people that you treated, the people that you lived with.
Ali, I mean, I do a lot of thinking about this. I find it impossible to understand how anybody who is willing to open their eyes and go and see, if they can, go and see Gaza, to have any other opinion about what's going on. Ghassan I know well, and Ghassan I admire very much for what he does, not just clinically, but also for what he stands for and his willingness to speak up. And the only explanation I have is that there is so much fear that talking about the truth of what's happening is difficult to deal with from those who oppose what Ghassan and others are saying. Because the reality is very obvious. I mean, when people ask you, and historically we all know, but those of us who've spoken about Palestine for many years, and you talk about it gingerly, because people say, well, it's complicated. It's not. We know it's not complicated at all. There's no complication there at all. It's very, very simple. It's about a story about occupiers and people who are resisting occupation. There's nothing simple. There's nothing complex about it at all. And it takes someone to go out there and see it for themselves, and then say, as I've often heard, I could not believe that this would actually be happening, because it's incredulous. It's a story which is made of fiction. It's not something that you would imagine people doing, as is happening by Israeli occupation. So I've met people, many of them colleagues, but also previous mentors of mine who've done the same thing. And they were said to me, I went there, I just had to go there once and see what it was like. And I'm talking about 15 years ago, not even now, for them to realize what the real story is. So I mean, my only attempt to maintain sanity in my own mind as to how anybody could see that there are two sides to the story of the genocide that's going on is go and see for yourself. Of course, you can't go for yourself, because even in inverted commas peaceful times, entry into Gaza is controlled by Israel. Even nowadays, I can only get into Gaza because COGAT, the Israeli authorities, will allow me to go into Gaza. And my movement in Gaza is coordinated with them. It's perverse, it's ridiculous, and the fact that those in authority feel that this is normal begs many, many questions about people's sanity.
And now that you're back in the UK, are you able to speak with people in government, in parliament, and have the media been interviewing you? I mean, is anyone listening?
People are listening. I think people are genuinely more interested now. I think more and more people are realizing that what's going on is madness, and that the story is trickling out. I do take hope in the fact I sort of have some optimism, because what the people I'm talking to more and more are a wider cohort of people. They're not the same usual, the kind of, to overuse that phrase about echo chambers that we're in.
I hope that connection will come back.
Yeah. Seems to be, oh no.
Hopefully it will. Hopefully it will come back. While we're working on that, I just want to clarify something, because I saw people asking about it. The ban on Dr. Hassan Abu Sittah was overturned by a court. It wasn't actually lifted voluntarily by the German government. And Dr. Abu Sittah, as a result of this ban, he was actually banned from entering Germany on April 12th, when he was planning to attend a conference in Berlin on Palestine. I was invited to the same conference, and the German police raided it and shut it down within an hour of it opening. I didn't travel to Germany. I was supposed to join it by video, but they even prohibited that, and they banned Dr. Hassan Abu Sittah, the British-Palestinian surgeon. And the day before he was banned from entering Germany, he was inaugurated as rector of Glasgow University, where he was elected with 80% of the votes on a record turnout, which again shows how the student body values the work he does. But the ban imposed by the Germans affected him. He wasn't able to enter France or the Netherlands either. And just yesterday, his lawyers from the European Legal Support Center and the international, it's in this article that I wrote earlier today, I forget the name of the organization, they managed to get a German court to overturn the ban. So I don't know if we're able to get
I think he's back. Yes.
Okay, great.
Hi,
Wonderful.
Dr. Khaled.
Sorry about that.
That's okay. I wanted to ask you finally, a lot of people in the comments are saying, I don't know how, how he does it, or, what it's like, having to live with these nightmares and over and over again of seeing people, knowing, that there, if this, if that it didn't have to happen, that these that Israel has been doing this for 76 years, and it's not stopping. What keeps you going? How do you, like, what's the motivation for you to keep going, not just going to Gaza and working there, but also coming back home and telling these stories?
I think two things, Nora. I think if I was to try and contextualize it in my own mind, try and bring some kind of understanding to my simple thinking about how this can be, and how does one accept it and live on accepting that this is going on not far from where I am, in relative terms, is that first of all, I think about the small aspects of it, the individual differences. That yes, I completely recognize that I and many others who have gone to Gaza, I'm not the only one, there are many others like me who've gone to Gaza and probably been even more helpful than I have been. And that is that you touch individual people's lives, and you hope that that one individual person somehow gets amplified, and they happen to be somebody that can do something later on. And this is whether you do it out in Gaza or whether I do it here in the UK by speaking to you and others about it. I'm hoping that somebody listening, maybe not directly, but they pass on that message, and then the next person can do something, and that amplification, that cascade effect, will one day have an effect. And I hope it's soon. I do hope it's in my lifetime, and I do genuinely believe with optimism that will happen. And overall, in the kind of bigger picture of things, I think, and this is why it's important to speak out and be clear about this, is that I'm a very big believer in history. We know history, these things don't last forever. Such injustices, such extremes of behavior and cruelty do not last forever. And one day we'll look back, again, I hope it's in my lifetime, but maybe not. But if we look back and say, this is where it all started, and things change. It took a while because we're, as human beings, we have a relatively short, finite lifespan. And then you've got to look at the bigger picture. What will happen in 100 years' time or 200 years' time when we look back and say, was this the spark that created the change that was required? Now, I know that is not a huge amount of comfort for people who are suffering through this at the moment. And that's the bit that's really difficult to come to terms with, because you can't change the suffering enough. You can do individual acts of kindness, but do they affect the large population? No, they don't. And this is me going back to saying, what I do over there, or what doctors that go out there, we are providing only a drop in the ocean of need. That is the need in Gaza at the moment. But that's where I go back again and say, you hope that spark creates something else, which becomes a tipping point. And that's how I think about it.
And if those of us in our audience who are not doctors feel like, what they're doing isn't enough, and I'm speaking for myself as well, there's all this feeling of like, even though we're doing what we can, it feels like it's not enough. What do you say? What's your advice?
I say we all feel the same way, whether we can go or not. This is a and I kind of, it really is a living nightmare of all of ours that we feel we're not doing enough. But I can tell you from my own personal experience, my own interpretation, my own thoughts, I feel that the speaking out is much more important than going to Gaza and visit. The importance, I think, of going to Gaza for me was, yes, doing the clinical work, helping with some of the operations. And as I say, it's a drop in the ocean. But actually, I feel it's more the listening to their stories and showing them that we have not forgotten them. Their biggest worry was abandonment and being forgotten. And us being there and telling them about what's happening outside, like in the UK and the US, around the world, is such a revitalizing message that they, and I do not exaggerate when I say I've seen people with tears in their eyes from me just saying to them, no, we haven't forgotten about you. And there are these things happening out there in the world. And there's a lot of support for you, but we just haven't got to the point of convincing those in authority to do so, but it's getting there. And that voice is so important. So please don't feel this is hopeless. And I've said this to so many people here who say the same thing to me. I wish I could go and help. Yes, that would be great, but many of us can't. Most of us can't. And your voice makes a massive difference. And it's not just a cliche.
Thank you so much for that, Dr. Khaled Dawas. We know that you work with the British charity Medical Aid for Palestinians. The other one, was it 𝐓𝐿
So 𝐓𝐿 is the educational medical school education charity, and I went with MAP and also the International Rescue Committee. They were the ones that organized our trip to Gaza.
Wonderful. So if people want to learn more about the work that those organizations do, they can check out Medical Aid for Palestinians, the International Rescue Organization,
Committee
Committee,
and 𝐓𝐿. Yeah.
and 𝐓𝐿. Excellent. Thank you so much, Dr. Khaled Dawas. We'd love to have you on again to talk about your work.
Darling.
Thank you so much, Dr. Khaled. It was really tough, but important to listen to you, and I hope many people will have a chance to hear what you have to say.
Thank you.
Yeah. Thank you so much.
Thanks for watching this video. Please subscribe to our YouTube channel, hit like, leave a comment. These engagements help us with the YouTube algorithm, and it helps us to get around Silicon Valley censorship as much as possible. It does make a difference. You can also support our journalism by going to electronicintifada.net and clicking on donate now. Thank you.